Welcome to ACON's Vaccinate with Confidence Community Forum. That's what we're calling it. Did I get it right? That's what we're here to do today, to talk about all of the questions that have been coming through from our wide sort of reaching community around vaccination. We have some incredible health professionals here with us this evening to answer a lot of those questions, and I suppose to give us a bit more of a broader context on some of those questions as well. There's a lot of mixed messaging, a lot of confusion around and has been for quite a long time through the pandemic. So it's really, really great that we have the opportunity to do this tonight. So firstly, a big thank you to ACON and the peer education team for organising this, and to all of the health professionals for being here with us tonight. My name is Patrick Abboud. I am very, very happy to be here. It's nice to be in the company of some queer folk, the community more broadly. I miss being with my queer fam, I'm sure we all do. So it's really nice to kind of gather together tonight. Before we start tonight's proceedings and sort of get some of the basics underway, it's my honor to introduce you to Yvonne Weldon. Thank you so much for being with us tonight, Yvonne. For those of you who haven't met Yvonne, her CV is very impressive. Yvonne is a proud Wiradjuri woman who's volunteered and worked in Aboriginal and non-Aboriginal roles throughout her career. Yvonne's also the first Aboriginal Australian candidate for Lord Mayor of Sydney. That's huge, congratulations. Yvonne was awarded the 2019 New South Wales Volunteer of the Year Adult Volunteer for South Sydney Region, and the 2019 New South Wales South Sydney Volunteer Region Volunteer of the Year. I had to read that because there's so many, there's so many words in there, so many accolades, and so well deserved. Yvonne's article, True Country, was published in the December 2019 Vogue Australia magazine. It was beautiful. Thank you so much for writing that, Yvonne. I read it and absolutely loved that piece. If you haven't read it, you should go and check it out. Yvonne is also the chairperson of the Metropolitan Local Aboriginal Land Council, a board member of Domestic Violence New South Wales, a board member of Redfern Georgian College, and the deputy chairperson of New South Wales Australian Day Council. Again, Yvonne, thank you so much for joining us tonight, and it is our absolute privilege to have you here doing Welcome to Country.
Thank you, Pat. Hello, sisters and brothers and everyone. As I said, my name is Levon Weldon. I am a Wiradjuri woman from Cowra here in New South Wales. I'm from the waters of the Clare, which later became known as the Lachlan, and of the Murrumbidgee Rivers. I am the elected chairperson of the Metropolitan Local Aboriginal Land Council, who are the cultural authority under the Aboriginal Land Rights Act for the land that I am on. I have grown up on Eora country, and as Pat had said, proudly, I am the first Aboriginal candidate to stand for Lord Mayor of Sydney, for actually any Lord Mayor in any major city of this country. So let's make history together through my milestone to be achieved for all of us. I pay my respects to all elders past and present, to all First Nations and everyone that's online today, and the many nations and clans lands that you're on. Again, on behalf of the Metropolitan Local Aboriginal Land Council, welcome to Gadigal land. This always was, always will be Aboriginal land. Thank you and have a wonderful evening.
Thank you so much, Yvonne. It's, again, a real privilege to have you with us. It's lovely to see you again. I hope to see you in real life very soon. And yeah, thank you once again for your beautiful Welcome to Country.
Thank you.
I'm going to move on to a bit of housekeeping, guys. It's so nice to see people joining the conversation. If you do have questions tonight, please feel free to pop them in the Q&A section in your Zoom toolbar. Have a quick look, you'll see it down the bottom. And I'll get them answered by the panel if we can. We'll try and fit in as many questions as we can as we go. So if you do have questions, again, just pop them in the Q&A toolbar. You should see it in your Zoom panel. We've got a lot to get through tonight. There's already a lot of questions out in the community that we want to try and answer and sort of give context to those, as I said earlier. But feel free to throw questions in as we go. And if we miss them, apologies. There's probably going to be quite a few. There's already quite a few popping up. I'll try and scroll back up, and we've got our moderators from ACON here, Harrison and Locke as well, who will keep me in check and make sure I don't miss questions. So hopefully we'll get to as many as we possibly can. As I said, when we first kicked off, the point of tonight is to get some really crucial information that has clarity. There's been a lot of mixed messaging out there in the community across media outlets, particularly around COVID vaccinations. And we're here tonight to get them answered by our incredible panel of health experts. Thank you again to all of you for volunteering a time and being here. Speaking of, let me introduce you to them right now. Our first panelist for tonight is Andrew Grulich. Gullick, I hope I said that right, Andrew. Which one is it?
Good.
Grulich. Andrew Gullick. Professor Andrew Grulich is an infectious disease epidemiologist and public health physician at the Kirby Institute at the University of New South Wales. He's been working in HIV and sexually transmitted infection prevention for the last 30 years. In 2021, he's been a member of the Australasian Society for HIV Medicine's COVID-19 Task Force. Very, very warm welcome to you, Andrew. Thank you for being here.
Thanks, Pat.
Our second panelist for this evening is the wonderful Associate Professor Holly Seale. Hi, Holly. Associate Professor Holly Seale is a social scientist at the School for Population Health, University of New South Wales, Sydney, and the Deputy Chair for the Collaboration on Social Science and Immunisation. Holly has over 17 years experience in immunisation and infectious diseases. She's been undertaking pandemic-related research focused on community and clinical-based settings since 2007. It's wonderful to have you here, Holly. Also, thank you for volunteering your time and great earrings.
Thanks, Patrick.
I love those. Our final health expert for tonight is Dr. Kathleen Wild. Kathleen Wild is a GP in Newcastle, New South Wales, where she works with a special interest in gender-affirming healthcare and sexual reproductive health. She's been involved in the COVID vaccination rollout since its inception. Welcome, Kathleen. Great headgear. Everyone's got something. I love it.
But when you can't have a haircut.
Andrew, you need some headgear. You need to join the headgear club. I've got earrings. That's my thing. As I said, we've got so much to get through. There's already people in the chat session saying this is a great idea. I'm so glad ACON is doing this. I agree. It is a wonderful initiative. And, you know, for me, I mean, I'm a journalist. You know, my job is to communicate information with clarity. And I found that incredibly difficult through the entire process of the pandemic. And, you know, that's my day job. So if I'm finding it hard to digest information, to communicate it out to the rest of the nation, I can only imagine how difficult it is for people getting it on the receiving end. And, you know, with things changing rapidly every day, multiple times a day sometimes, it is really hard to keep up with things. And, you know, the thing that alarms me the most is that there's a lot of misinformation out in the community. Broadly in the national discourse, there's a lot of misinformation, but particularly in our community, I think, from conversations I've had just even in my own circles, and people coming to me and saying, hey, you know stuff, you research stuff, what does this mean? Or what is, what are the implications of this? And often I find I'm scrambling for the right answers. So it really is a wonderful panel that ACON has put together. And I think you'll find that a lot of those questions and a lot of that sort of misinformation, hopefully, well, at least some of it, we can clear up through tonight's forum. I suppose it's probably a good idea just to, let's keep this really brief, as I said, because we want to get to, the sort of crux or the meat of tonight very quickly, because I think that's where a lot of the questions are going to come up. But to take us there, Andrew, Kathleen, maybe I'll direct this question to the both of you. Very briefly, what is COVID-19? What does COVID-19 do to the body? Do you want to kick us off, Kathleen? You just unmute yourself.
Yeah. So COVID-19, it's a, if we want to be technical, it's something called a coronavirus, and it's a mutation of, we've had coronaviruses that have been around in the human population before. That was what was SARS. And to be very simplistic about it, the main way we worry about COVID-19 harming the body is that it causes an intense respiratory distress and respiratory inflammation and failure, so that people stop being able to breathe. The other things we worry about COVID-19 doing to the body is that it does seem to set off multi-organ inflammatory response, and that can cause damage in a bunch of organs, including blood clots that we hear a lot about with vaccine, but less so with COVID-19 itself. And after recovery, it does seem to be that there is a degree of long-term effects of COVID on the body as well, that are still being fully worked out in terms of what exactly has happened to people who've experienced that disease and how do we try and treat it as well.
Andrew, as an epidemiologist, I mean, I've interviewed several epidemiologists over the past couple of months. And as I said, I still feel like I don't have 100% clarity. I have a lot more clarity, but it's very difficult to keep up with, the ever-changing state of this disease, of this virus, and, the sort of new mutations. But what is the current COVID-19 situation in New South Wales broadly? If you could answer that for us, Andrew, as with your epidemiologist hat on, that would be really helpful.
Yeah. So where we are at the moment is all because we have a new variant of coronavirus called the Delta variant of COVID-19. And this is clearly, has clearly evolved from what's been happening in humanity for the last 18 months. But it's clearly more infectious than the original subtype of COVID-19. And so what this has led to is that the forms of social distancing that worked previously, that worked for the previous virus, just didn't work as well for this virus. So despite the implementation of social distancing, of lockdown orders in parts of Sydney and then all of Sydney, of us all staying at home, that hasn't been enough to control the virus. It probably would have been enough for the previous variant. And so we're seeing, over 1,000 cases a day. The virus is definitely partially being kept in check by the lockdown measures. If it weren't for the lockdown measures, we'd probably have 500,000 infections in New South Wales by now, in Sydney by now, and thousands and thousands of deaths. So the lockdown is working to some degree. It just hasn't been enough to get us back to zero. And that's where really targeting vaccination as quickly as possible has become part of the response. So where the infection is most common, and it is still most common in the west and southwest of Sydney, there's been amazing efforts to get vaccine uptake up and running quickly, because even a single dose of the vaccine does decrease the infectivity of people and protect people somewhat against infection. So Blacktown, for example, is almost 90% vaccinated now, which is just remarkable in a few short weeks. So where are we today? If you want some slightly good news, over the last 5 days, what we call the rolling 5-day average for the first time has slightly turned down. So there is a hint that perhaps we may be at the peak of this epidemic. It's a little early to call it yet. And even when we do reach the peak, it will take many weeks of increased vaccination and, I'm afraid, continued lockdown before we get back anywhere near zero.
Well, let's hope through tonight's forum we get those vaccination rates up even higher. That's what we're hoping.
Yeah.
That's
Holly, what we need for control. Yeah.
Yeah, as evidently as you've just explained. Holly, I suppose this might be a good one for you to answer if you can. COVID seems to be impacting different communities in different ways. What do you feel are some of the disparities we're seeing, sort of more broadly, which COVID has made more apparent in the way it's affecting those different pockets of the community?
Yeah, Patrick, look, that's a great question. And when we talk about impact, we could be thinking about different things here. And of course, obviously it's about health impact and about whether or not people are ending up in hospital or on ventilators or even dying, unfortunately. But of course, impact to others may be about financial impact, about opportunity to work and to carry on, doing what they normally do. And so, this is where, we've got to think of all of a broad range of different impacts when it comes to COVID, but certainly from the research evidence and what we've been seeing in international settings and here in Australia is that, we know COVID certainly does tend to impact those who are, in certain communities, in potentially in lower socioeconomic areas, in situations where people may be, in workplaces with more frequent public contact than in other settings. And, you know, that picture certainly has played out here in Sydney where, you know, with seeing the people who have ended up, you know, catching COVID and the settings where COVID is transmitting. So, you know, that is where, you know, we've certainly been, you know, supporting efforts to make sure that when we move forward with vaccine programs, is that we don't end up leaving anyone behind, and that we have, you know, no disparities, no gaps in vaccine coverage, that when we hit this magic 70% coverage level, that it's not just 70% in some settings, but it's 70% in every important setting.
Yeah.
Patrick, can I just make a note? I've been trying to answer some of the questions also in the chat. So if people think their questions have disappeared, it's because I've answered them. So make sure you just have a look in the answered box too. So I've been a bit sneaky trying to answer some of the questions as we roll.
That's fantastic. Thank you so much, Holly. That's wonderful. I'm just having a look now too. Yeah, there's quite a few. I won't take questions just yet, but that's great. If in between you do want to jump in, and any of our panel tonight, if you want to jump in and do that, feel free, just so we're not missing anyone. We'll definitely include some questions as we go along. But before we get there, I just want to, I suppose, you know, this seems really obvious to everybody at the moment because we're getting, as I said, there's so much information daily to take in, and the things that we should be doing to protect ourselves from COVID seem obvious, but I think it's good to just quickly run through, you know, maybe the top line ways that you as health professionals would recommend people to best protect themselves. We're going to get to vaccines in a minute, but in addition to that, Andrew, what are your sort of top 3 must-dos?
Well, you know, it's really in the government lockdown that we're in at the moment. It's not coming into, staying at home as much as you can and not coming into contact with others. It's wearing a mask when you do need to go out, particularly when you're in internal spaces like in the shops. We do now know that this virus is transmitted not only through droplets, which are what you spread when you're speaking, with the tiny little droplets that tend to drop down to the ground within 1.5 meters. It's also spread by what we call aerosols, which means it lies hanging in the air for, you know, really quite considerable periods of time. And that's where having a properly fitting mask can help reduce infection. I will say that you know, we still have an emphasis on hand wash and disinfection. That's probably not resulting in as many transmissions as the respiratory modes through breathing, but it's still worth doing.
There's lots of questions coming through, and I suppose I expected this, and you as a panel of health professionals will be expecting it too. There's a lot of questions around different kinds of vaccines, what the side effects are, all of those questions that have been circulating since, you know, the beginning of the pandemic and since we've had the vaccines available. So I will get to a couple of them in a second, but there's also really basic questions about what vaccines are currently available right now and which is the right vaccine for me. So perhaps Kathleen, you want to jump in there and just answer that one really, really briefly, and then I'll throw in a couple of questions from the audience that are online.
Yeah. So there are 2 vaccines which are currently available and one that's just about to come on the market. So we have the AstraZeneca, which has just been rebranded as Vaxzevria, if you'd like to just continue to be confused. And that's a vaccine that was designed by hollowing out a whole virus and putting in something that looks a little bit like COVID-19 into it. The other options are called mRNA viruses, which are a different design of vaccine, and they are the Pfizer and Moderna vaccines. So the AstraZeneca vaccine is available for everyone over the age of 18, I'm licensed for that in Australia, and as is the Moderna, and the Pfizer vaccine is currently licensed for everyone above the age of 12.
Okay, one question that seems to be coming through quite often is herd immunity possible with COVID vaccines? Let's stay with you for that, Kathleen.
Oh, I don't know if I want to get into a fight with an epidemiologist about this.
I'll come to Andrew in a second, but I'm interested as a GP, what's your take?
Yeah, my understanding about the nature of COVID-19 and the effectiveness of the vaccines we have available is that herd immunity is probably not something we can aspire to with this particular disease and these particular vaccines. I'm not sure, Andrew, if you've got any other advice about that.
I might just quickly.
You're a resident epidemiologist, so
I might quickly define herd immunity because it gets thrown around a lot. And essentially, herd immunity is the concept that if you vaccinate enough people, and it might be 80, 90, 95% of people, then the virus can no longer be sustained in that population because transmission is not happening. And depending on how effective vaccines are against people passing on a virus, it really could be anywhere between 60 and 100%. The issue with the COVID vaccines is that they are really fantastic, really excellent against protecting you against severe disease. They are less fantastic against protection from passing on infection. And because of that, the level of vaccination we would have to achieve to get to true herd immunity, where there's not going to be any sustained transmission in the population, is extremely high, probably well over 90%. And so for that reason, we don't generally think at the moment with our current vaccines that herd immunity is going to be feasible.
Okay, there's a question from Tim Snell in Armidale, and I really wants this answered. So let's stay with you, Andrew. Tim says, I'm in Armidale and we have had 2 false positive readings. Why does this occur and what actually happens? It's a great question and one that's come up quite often in the last couple of weeks in the media as well.
So false positive using the laboratory assay. So if Tim is going to get the swabs that are being sent away and sent to the lab, they're actually very rare. They're very, very uncommon, and they can be sorted out by follow-up testing. The most common reason for a false positive in most settings is laboratory contamination between specimens. It's extremely rare. So to happen twice in the same person is even rarer. And I'm afraid I can't explain why that's happening to you, Tim.
You can't explain why the false positives happen?
No.
Is it a lab? Is it just a simple kind of lab issue in terms of the pathology?
It certainly can be a lab issue because these tests are so extraordinarily sensitive. They are amazingly sensitive. And so if there's any contamination from previously collected specimens, for example, then that can lead to a false positive. That is one potential. I should say that some of the other tests that we use, the rapid tests that can be done on the spot for workplaces, they can have a higher rate of false positivity than the laboratory tests, which, false negatives occur, but false positives are extremely uncommon. But obviously, they do happen.
This is another question from an audience member to the whole panel. Is the Lambda strain something that the Australian medical community is concerned about? How do these different variants impact the body from the originating strain? Andrew, let's start with you.
Yeah, okay.
You're looking perplexed.
So we're always concerned about new variants of the vaccine. There is an international system of classifying them. Certainly the Delta variant, one we've currently got, has been the one that's created so much problem. There are no subtypes at the moment that are of extreme concern to us. The Lambda subtype does not seem to be predominating broadly. It is worth saying that whenever we have large number of people, as in millions and millions and millions of people becoming infected, it is inevitable that new variants will evolve. And that's why we really, to protect ourselves fully against COVID, not only do we have to be vaccinated, but we have to ensure that the whole world is vaccinated to get global control of this infection.
Yeah.
Currently we've got shockingly low rates of vaccination in low-income countries, which is completely unacceptable.
there's a lot of community questions around vaccine safety. So, I suppose we've talked a little bit about the main 2 vaccines we have, and potentially is a third on the way. But I think a lot of the fear and a lot of the misinformation comes from not understanding exactly what potential side effects are, how each of the individual vaccines may or may not affect you based on pre-existing conditions, all of those sorts of considerations. So, Holly, I'm going to go to you on this. I suppose the general question that combines the multitude of questions that are coming in on this are the vaccines safe? And how do people know they're safe? What can they sort of rely on to know that they're safe? It's a broad question, but it's one that I sort of encapsulates a lot of the questions coming through from the community about vaccine safety.
Yeah, look, and that's, this is where really, when we look at the data that's been collected about why people may not yet have decided whether or not they want to receive a vaccine, or whether or not they're just kind of watching and waiting to see what happens, a lot of their kind of concerns do center on side effects and the safety of the vaccines. And, kind of part of that, of course, is this kind of concern that the vaccines, of course, were developed in a very short time period compared to what, of course, we talk about normally with vaccine development happening.
Just on that, Holly.
We've gone too quick.
On that point, there's some questions coming through on this too, and let's just try and answer those now. Were vaccine approvals rushed? Because as you said, they normally take a long time. Does the medical community in Australia feel that, is there discussion around that they feel perhaps they were rushed? Is that why some of the fears there?
Yeah, certainly this question comes up a lot. And, what's important to really note here is that, yes, we acknowledge the time frame was definitely different to what we've seen previously with vaccine development. But what we need to acknowledge is a couple of things. Firstly, the main thing is that actually the scientists had a bit of a head start that they haven't really told us a huge amount about, but they should have been, that they had actually been working on the vaccine platforms or the delivery strategies for these vaccines for a while, that they'd actually been working on them for 10 plus years. Because as Kathleen said, COVID has cousins, this corona family, has, lots of different branches. And, they've actually had other kind of similar viruses that they could use to test these platforms on. And so then COVID popped up. So they were able to quite quickly pivot to testing these platforms with this new corona type. And so what we had was a little bit of a head start here, of course, already. But also what probably is most important to know is that the amount of resources, people time, government support, pharmaceutical companies thrown at the development of these vaccines was unheralded. We've never seen this in vaccine development. And certainly let's hope that we see this happen again with other important vaccines down the track. But one other important thing that I certainly learned more recently was that actually it wasn't just the scientists that really stepped up, but it was also people. It was people power that helped these vaccines get developed in the way they did. So each of the COVID vaccines that were developed actually had 5 times more people involved in the trials than what we normally see in the development of other vaccines.
Right.
So that means we had a huge amount of people coming and participating in all of the different phases. And so they were able to grab that data and use it to inform the next phase really rapidly. And so that is, really helped with moving these things along. But, can I go back to the safety? Because I know
Go back to, I suppose the side effects question is one. A lot of those questions have been answered, in the public discourse. There is a lot of clarity around what the side effects are, particularly with Pfizer and AstraZeneca. So I suppose maybe a better place to focus our attention tonight, because we don't have a huge amount of time, is more, I suppose, on the long-term effects of vaccines, because that's the question that, again, is coming up now and has also already been put forward in the sort of community
in the chat.
Do those long-term effects of the vaccine outweigh the benefits of the vaccination? I think that's the key question.
Yeah. So Patrick, here, what we need to be really careful of is actually these are so-called long-term side effects is actually a bit of a myth. And so important that we do acknowledge that there are local side effects and events that might happen. And I've put some great links into the chat, also into the Q&A for people who are interested in understanding in right now, you know, who's experiencing what in terms of getting vaccinated. Yeah. But this is, you know, that is just the shorter term events. Of course, then we have the rare event with AstraZeneca, which is the blood clotting. And, you know, this again is a different topic than what you're referring to is, you know, what's being talked about is long-term side effects. So these are side effects that, you know, supposedly turn up years down the track with vaccines. Now, this is why I say this is a bit of a myth, is because, you know, what we need to understand firstly is about how vaccines work in the body. So when the vaccine gets injected, you know, it kicks into gear very, very quickly here. And probably Andrew's groaning at the language I use to describe how complex vaccines work. But I love this language.
Epidemiologist.
Because, and to be fair, I've got a PhD in epidemiology, but I still use this language because this is what we need to understand. Vaccines get into the body, they kick in, you know, they might be a set of instructions that the body reads, and it all happens quite quickly. And so if you are going to have a rare side effect because of a vaccine, it's going to happen quite quickly. And even with the blood clotting, it is happening between 2 and 40 days. And so this is why when we introduce a vaccine, if there's going to be one of these rare side effects, it's going to show up quite quickly when we vaccinate enough people in the community.
Which we're actually seeing. I mean, we're seeing that. That's exactly what's playing out.
And we saw that with the AstraZeneca vaccine. And to acknowledge, we've seen this in the past with vaccines. And this is why we've got such great surveillance systems in Australia that we jump on these things and we change or we alter our recommendations. Now, we've also, when we think about this issue with long-term side effects, we've got to look a little bit historically too. And we've got to look, we can look all the way back to the 1960s for when they introduced the oral polio vaccine. And then in the 70s, 80s, 90s, and today, all of the different vaccines they've introduced, history has repeated itself. We've had, yes, some vaccines that have had very rare side effects turn up, but we have never had a side effect turn up years down the track, because it goes back to our first idea about how vaccines work in the body. They don't hang around and cause these issues long-term down the track. Now, I know what someone's thinking right now. They're going to go, but hang on, this is mRNA vaccine. This is all new. How can she be so sure? Well, you know, the challenge with that is probably the person was thinking that back in the 1960s, and this is a little bit before my time, but when we introduced the oral polio vaccine, because that would have been really new technology too for the people. So, you know, we've gone through this motions.
It's precedent.
And every time it's been the same picture every time.
I think a very specific question to many in our community is around PrEP or antiretroviral therapy. There seems to be a lot of questions coming through from the community around whether or not the vaccines interact with PrEP or antiretroviral therapy. And if you are on them, do you need to stop before you get a vaccine? So that could be something that's sort of, I suppose, preventing people in the community stepping forward to go get the vaccine because they're unclear around the impact on that antiretroviral therapy. So Kathleen, can you comment on that?
So there's no contraindications associated with any antiviral medications and having any of the vaccines. I think it's fairly succinct. There shouldn't be any interaction between it and your medication.
Okay, so the most common question seems to be, do, you know, say I'm taking PrEP or antiretroviral therapy, do I need to stop before I get the vaccination? The answer is no.
No.
Okay.
Can I just add to that? Because I've heard people talking about that, and and people even being asked if they're taking antiretroviral therapy. Sometimes the question from the health practitioner is actually about trying to get to a person's immune status, because if a person has HIV infection and is severely immune deficient, then the vaccine doesn't work as well in that person. It's still perfectly safe, but it does not work as well in people who have severe immune deficiency. We usually talk about a CD4 count of less than about 350. With higher CD4 counts, the vaccine appears to work really well, which is great news. So people with HIV, there is some emerging evidence that the disease can be a bit more severe in people with HIV. So absolutely, that's actually an extra reason to get vaccinated.
So I might just add that that's true for people with all manner of immunocompromise and people who are taking immunosuppressive medication, in that while that they should absolutely still have the vaccine because the nature of their conditions mean that they're in increased risk if they were to get unwell. They're not at any danger from, you can't get COVID or a viral illness from any of these vaccines, even if you're immunocompromised. There's perhaps some argument, I think someone made a query about Stelara, one of the monoclonal antibodies. There's some questions about timing your vaccine, perhaps around if you're getting periodic dosing to maximise effectiveness, and that should be, is worth discussing with your professional. But these vaccines are still safe if you're immunocompromised.
Let's just stay with you, Kathleen, for a moment, because there's more questions coming through on hormone treatment this time and the interactions there. So are there sort of other health considerations specifically for the trans community, so who may be on hormone therapy of any kind? Thinking about things like chest binding and respiratory risks, or TNE interactions. Yeah, maybe talk to that for a moment, because there seems to be quite a lot of confusion around that.
Yeah, and particularly regarding, say, the risk of blood clots, I've been getting a lot of questions from my patients about this. So the AstraZeneca vaccine does have a risk of a rare blood clotting disorder called vaccine-induced thrombocytopenic thrombosis. That clotting disorder is very different from the clotting disorders that we counsel you about when you're starting estrogen and ciproterone. So it's kind of like how you can have a runny nose from the flu, or you can have a cold, or you can have a runny nose from hay fever. You end up with a runny nose, but different disease processes have led you there. The clots you get from the AstraZeneca vaccine are more like an allergic reaction that have triggered a clotting response. And the risk of that happening is not affected by being on estrogen or other medications that we warn you might increase your clot risk. And so that's the main concern I've had from people on feminizing hormone therapy. For people on testosterone, there's no specific concern or interaction with any of that, with any of the testosterone formulations. I have seen some concern about chest swelling following the Pfizer vaccine, and that can be related to the lymphatic response and lymph node swelling, and that's a self-resolving state. It's not going to be permanent. It's not related to any glandular breast tissue enlargement. It's sort of like how your lymph glands under your neck swell up after you get a cold. And I think then as well that comfort's going to relate to binding after the Pfizer vaccine and just being sensible about not causing yourself pain when you're binding as you should do.
What about very basic things? If you're on testosterone, say like high blood pressure, is there any sort of implication on blood pressure because you're getting the vaccine if you are on T?
I think there have been some isolated concerns about I've seen some anecdotal reports about higher blood pressures following the AstraZeneca vaccine. I'm not aware of anything specifically for people on testosterone, but I think it should be followed up as part of your routine monitoring when you're on those medications.
Okay, great.
But it's not a specific risk or anything that we're looking out for. We're not screening blood pressure in any of our clinics before we administer the vaccine. Doesn't relate to your safety there.
Andrew, I'm going to put this question to you. It's a very specific one. Someone in the community says, I have a severe autoimmune disease, compromised immune system. I'm fully vaccinated, but should I ask my GP for an antibody test to see if the vaccine was effective in my system? You touched on this before, but maybe just expand on that.
Yeah, so the vaccine is likely to be slightly less effective in people with severe immune deficiency and on some medications. A simple blood test can't really give you the answer. The blood test is for antibody levels, but doesn't test for the cellular immunity, which is probably at least as important. So there's no blood test which can give you an absolute answer. The other aspect of this, and Kathleen can probably confirm this, is it's my understanding that in Australia we do not yet allow third doses. We're still reserving vaccine for the first two. There is great debate going on now about booster doses for people with immune deficient states. Is that right, Kathleen?
Yeah, and we're getting a lot of questions about that, and I just have to tell people I'd be making anything up if I told them. And certainly in the UK, they're starting to vaccinate immunocompromised adults who are, I think, 6 months after their initial vaccine, but we don't have any guidance in Australia. And I think certainly it makes sense for the public health response to be around making sure everyone gets access to that first dose.
Yeah, there are some questions coming through on that too. And that's actually a question I had, because I have read that in the UK, they've started to give a fourth jab. Why is that? And how is that even possible? What are the implications of that? Is that something that we may have roll out here? Kathleen?
So I think that it's very likely that that will be, part of the schedule. We certainly have vaccines which have more than 2 dose courses, like our hepatitis B vaccine, for example. You get, a dose at, dose A, booster at a month later, and a booster at 6 months. This is a new vaccine, and they're still trying to figure out what the best, vaccination course is to optimize immunity in everyone. And I think it's, incredibly likely we're going to be doing boosters, but we just don't know yet what the best thing is for everyone, and between the 2 vaccine options that people have had as well, because a lot of the data from overseas is regarding Pfizer.
Okay, we've talked a little bit about, what vaccines are available, what are some of the sort of myths around them in terms of side effects, long-term effects. That sort of led us into a bit more of a conversation around more broadly vaccine safety, because obviously that's probably the biggest barrier for people going forward and getting either AstraZeneca or Pfizer. So hopefully we've answered some of those questions. And again, for everyone that's online and in the community at the moment, Holly is answering a lot of questions in the Q&A chat box. Thank you, Holly, which is helping us get through lots more, because there's quite a few, which is great to see. It means that this was very much needed, and people's questions are being answered. I suppose one thing that is really important to understand is why there is this hesitancy. Apart from side effects and vaccine safety, there seems to be hesitancy more broadly in particular parts of our community, in the LGBTQ+ community. I want to go to you again, Holly, on this. Why do you think that is? What's your sense of what people are afraid of, or where does the hesitancy come from, apart from side effects?
Look, it's really important that we understand hesitancy, because, it can vary between people. It, of course, can vary over time and between different vaccines. So, in the past, people may not have necessarily received a flu vaccine, but may be happy to step up and get this COVID vaccine. And that all has to do with how we perceive the need. Around the severity of the infection, around maybe our personal vulnerability, but also of course we've got a lot of other levers happening with this vaccine. And so for those who are continuing to have uncertainties, it certainly is playing out that there is concerns around safety of the vaccine and misunderstandings around these long-term side effects. We've had, some uncertainty amongst pregnant women about whether or not they can get vaccinated while pregnant. And we definitely know that that's really important and that they can. But, beyond that, there may still be a proportion of the community who thinks that, they may not be impacted by COVID. And so, the risk to them then remains low. And so, having some conversations with friends, having a chat about, why did you decide to get vaccinated, actually may play a really important role, because a lot of the language from the government and, a lot of the language in the campaigns is all about, stopping disease and stopping my risk of COVID. Well, if you don't feel at risk, that's not really going to relate to you. But instead, what about travel? What about, going back to concerts, going back and catching up with friends? we all have different reasons that might motivate us to go and get vaccinated. And certainly just taking some time to listen to a colleague, to a friend about, how they're feeling and what they are looking forward to might help you find the hook to have a conversation with them about getting vaccinated.
I think there's a really important discussion to be had around, cultural sensitivities, language, those sort of things too, that are perhaps impacting hesitancy. A couple of weeks ago, I was working on a story around an entire family in Western Sydney who all got COVID, essentially. Somebody contracted it, one of the family members had contracted in a hospital, brought it home. Everybody in the family got infected. My own family experienced that. My family's in Western Sydney. My brother was infected, and then his children subsequently became infected. So there's a lot of conversation in those communities where English is not their first language, around I suppose not so much miscommunication, but maybe the lack of consideration for niche communicating with those particular communities. What are some of the concerns there that I think we need to bring to light, so those concerns, that those things are being addressed, I suppose, is the question. What can we do better to ensure that those communities are being reached in the way that they need to be reached? Because there's, we have queer communities out there as well. We don't all live in the eastern suburbs or the inner west. Western Sydney has a very healthy, popular, queer community. So population of queer people, sorry, I should say.
Yeah, look, and this is where, we need to look beyond, our politicians and our premiers and really look to, who are the people within our communities that we look to in terms of information. So I've had the privilege of working with culturally and linguistically diverse communities and multicultural health and refugee health organisations that support them over the last 8 months to really hear about what they are doing, on the ground to support their communities, and have been absolutely blown away by the volume of activity out there, and the resources that have been put in to make sure that we're not leaving anyone behind. And I keep saying I'd love to hear these stories being sounded out at the 11 o'clock press conferences.
But we all,
we still ended up with the same people, but never mind, it might happen. But we know that there are lots of good things happening. The challenge is, a lot of these people who are stepping up and doing these roles, they're doing it in their own time, and they're certainly not getting any payment for it, but are very willing. But it can also be very taxing on them to keep stepping up and having these conversations. And so we've certainly been advocating to get support and resources out into community. But I'm a big believer of peer-to-peer action too, and so really want to see more more resources and support given to the issue of misinformation, because on systems like WhatsApp and the kind of more closed,
which many of those communities are using frequently, that's their mode of communication often,
and that's great, and it means everyone is keeping connected. But we also don't have a sense of what misinformation's spreading as much as some of the other more open systems like Facebook and TikTok and the other ones that we use, YouTube. And so that is where certainly we can help community organizations to do this kind of debunking or breaking down of myths, but also we need to help people on the ground who are in these networks to learn, if you come across some wrong information or inaccurate information, should you do something about it? And just I think in the last week or so, we've heard a case of someone overdosing on a particular drug that they got off the internet, thinking that it would reduce their chances of COVID or help them if they caught COVID, and they ended up in hospital because of it. Last year I did some research mapping misinformation to COVID and the impact of that misinformation. And after Donald Trump came out and said people should swallow a particular chemical, which we know is not true, we actually mapped deaths in certain countries to people following his advice. So we know misinformation can have really deadly impacts. And so, you know, I do encourage everyone to step up, you know, and to try and see if you can have a go of getting some fact back into the conversation. And that's not easy. And it can be in a really emotional space. But
it's also a generational thing too. You know, I think there's some questions coming through, and I experienced this with the family that I referenced before. You know, the father of that family, you know, wasn't necessarily rushing out to get a vaccine. And he comes from a Middle Eastern background, and his extended family also weren't rushing out to get a vaccine. When they all became sick, you know, he's now communicating to the rest of his family and their extended family how important it is to protect themselves and to protect the rest of the community. So it's, you know, it's a selfless thing as well. You've got a whole community of people to think about, not just yourself and your own family. A community member's actually just asked about how to communicate the importance of vaccination when there are cultural or religious barriers present. This community member asks, I come from a family who doesn't support vaccination along different lines, whether it be religious, cultural. What can I do to help get both myself and them, essentially to understand the benefits of vaccination? What advice would you guys, and this is one for the whole panel, have for this person? Because I think this is probably coming up quite a lot. Again, I just referenced an example I experienced myself a couple of weeks ago, particularly in those communities where, you know, the rates are getting higher every day. And there is that sense of misinformation potentially in some of those communities. So what advice would you give when someone is literally saying, I want to help these people understand the benefits of getting vaccinated? How can they best do that?
One of the best things to do is listen. You know, so quickly do we jump on someone who said, you know, who comes out with one of these messages, and we kind of have this often reaction of saying, oh no, that can't be right. You know, how can you believe that? That sounds ridiculous. You know, come on. And that's what we call a righting reflex. And that can be actually one of the worst things to do in this situation, because the person will feel that you're just dismissing them too quickly. So, you know, when I've been doing training around communication, what I spend a huge amount of time is just to encourage people to think about, you know, how can you make the person heard? And that's often just by repeating back what they said to you as part of your response, but also seeking permission to share. And that means that, again, you know, the person's, you know, you're coming with them on their journey of you know, talking and you know, helping them to understand, you know, but you're not just forcing the information at them. You know, I think it's really important to note when we're faced with religious exemptions, is to draw back on the fact that every major religion around the world has come out in major support of the COVID vaccines. And that is very visible from all of our key faith-based leaders around the world. I'll let the other panels take over.
Andrew, do you want to jump in there?
Well, yeah, look, I'll just give an epidemiological perspective on this of something that's really concerning, and that's that if we leave any communities behind, and they're sizable communities, then as soon as we open up, the infection will rush for those communities. And that's happening now in the US. It's happened in Israel with some ultra-Orthodox sects who don't vaccinate. You know, the virus finds its way to them almost instantaneously after you open up. You know, if we're on time, we're about 6 weeks now from opening up at 70% vaccination rate. And the virus will find its way to under-vaccinated communities. You know, it's been appalling the way that we've known Aboriginal people were at risk, and we named them a priority, and yet their vaccination rates are lower than ours. It's a scandal. It's absolutely awful.
Kathleen, just a question to you, because you're in Newcastle. You know, I suppose a lot of the media, the press conferences every day, it's very much focused on Greater Sydney, and the information that we get day to day is very much focused in Greater Sydney. Are you having conversations around this sort of hesitancy with your patients in Newcastle?
Well, I guess I think my particular practice population, I work in a mainstream general practice in one of Lake Macquarie suburbs. We've actually had a really positive uptake from our patient population with regard to vaccines, and we got a very big initial supply. So we've kind of been a feeder practice for a lot of surrounding suburbs. Some of the specific areas I think have had a bit more reluctance than others, but generally I think I haven't seen a lot of hesitancy in the people I speak to. I think also there's been a lot of self-selection in that the people who are calling up to chat with us about vaccination are obviously really keen. So
that's great to hear. I think that the crux of tonight's conversation, and everybody sort of wants to know or wants answers to the impending future and the next few months and what that's going to look like for all of us. I think we all want to know. We all want answers to that. Before we get there, I just want to read one quick question out from the chat group, because it's a really interesting question. Fiona says, I really want to stop the spread, so I may decide not to see my close friend face to face who is choosing to be unvaccinated. I'm fully vaccinated. I want to make an informed choice around this. So she would like to know from the panel how much more contagious unvaccinated people are. I think that's a really interesting question. How do you answer that, Andrew?
So if Fiona is vaccinated, and so if she's concerned about her own health, then if she's fully vaccinated, then she has more than a 90% reduction in severe disease, and so should be very well protected. But she's concerned, I think, about passing it on to her friend. And if that's the case, it's still possible if you're vaccinated to be infectious and not know you've got the disease. It does greatly reduce your infectivity, but it doesn't remove it entirely.
Okay, I hope that answers your question, Fiona. Come up a few times, so I just wanted to throw it in there. We're going to run out of time, and I really want to make sure we have enough time to discuss the impending future, because that's what seems to be, I suppose, where there's the most confusion, and I suppose, and then not the clarity that people would like to have. People are following the updates day to day. They're trying to get a sense of what that means. People are making their own sorts of predictions. We're all doing it in some way, I'm sure, just because partly it's a comfort, and we need to try and create something to look forward to. That's very hard, obviously, because numbers are changing every day and the situation changes every day. And as you said before, Andrew, there's new mutations. Who knows where that's going to end? So I suppose this is a question for everybody. You can jump in whenever you like. What do you think the next few months are going to look like for New South Wales particularly? And what will be, I suppose, most important for us to be mindful of, particularly in the coming months? So, we've got this plan from the government that's just been announced, and it's sort of the pathway out. What are the sort of top three considerations for you, Andrew? And then I suppose as a secondary thought, what's your take on what the next few months are going to look like from an epidemiological perspective?
Yeah, so I suppose we have about 6 weeks until we hit the 70% double vaccinated rate. And during that time, we expect that the current epidemic we'll see a drifting downwards in infections within the next few weeks, I think, but we won't be getting to zero or close to it, I don't think. Unfortunately, with all of those cases, we are going to see more and more people in hospital and more people in intensive care and more deaths. It's not going to be an enormous wave of death, thankfully, but we are going to see some more deaths. The 70% will be quickly followed by 80%, and we should be aiming, as our Kerry Chant keeps saying, aiming higher than that. We should be aiming for 90%, because at the end of the day, because we won't be getting herd protection from this, people need to expect that if they don't get vaccinated, they will eventually become infected. And for people in their 20s and 30s and teens, most of that is not a very severe disease, but for the elderly, it's mostly a very severe disease. So, if I could give one message out to everybody, please tell your mums and dads, your grandma, grandpa, if there's anybody, any older person who's not vaccinated, it's the vaccine is the balance between harm and benefit is huge. Old people just need to get vaccinated. That would be my most important message.
Holly, do you want to jump in there? I suppose there's a lot of things people are, thinking through and trying to predict, as I said before. And I suppose with this pathway now that has been announced, people are concerned that perhaps people will become a bit too relaxed and that will bump numbers up again. In that, taking that into consideration, what should people really be mindful of, particularly in the next 6 to 12 weeks?
Yeah, certainly, the vaccine, is going to have, a big dent on, on COVID. But in terms of, really having an impact on who's going to hospital and who's ending up on ventilators and, who's ending up with those really severe cases. And that's exactly what we've seen in other settings. What we do need to be mindful of is that we still may see those case numbers, fluctuating. So that transmission may still occur. And what we may get is these kind of breakthrough cases where someone who's positive someone who's fully vaccinated may still turn up to be positive for COVID. And that's going to be part and parcel of this space going on. And it's not to say that these vaccines aren't doing what they're supposed to be doing. It's just what we're going to be experiencing. So, we do need to stay confident that, we're going to reduce deaths. We're going to see drops in hospitals. And a graph I saw just before coming on this talk really showed that we're looking like we're just about to hit that top of that peak and hopefully see see the other side, within a week.
You mean in peak in hospitalizations?
Yeah, in peak in hospitalizations and people going into intensive care. And I don't want to jump too quick and be quoted on that, but the data was looking pretty good. But, that's not to say masks they're going to be sticking around. So, if you need a new pattern or a new design for summer, now's the time to be getting those. They're not, this is going to be part and parcel of what we're doing, when we're on public transport, when we're indoors, that is certainly going to be here for longer. And
Andrew, can I just go to you there? Because you just said something that was sort of slightly contradictory to what Holly's saying. Are you saying...
terrible.
Holly's suggesting that we've sort of hit the peak, but you suggested earlier that, there's many more deaths to come and we haven't hit that peak yet in terms of ICU beds and people being hospitalized.
I was being optimistic here, Andrew.
I think so that we're realistic.
The peak in infection in every epidemic in the world always comes a few weeks prior to the peak in hospitalizations and ICU admissions. We do have a pretty heavily vaccinated population out there now, and many people who have had one dose of vaccine will still get less severe disease. So I don't think we're at the peak of ICU beds and hospitalization yet, but the peak of that, if we're similar to the epidemics overseas, will occur within about 3 weeks of the peak of infections. And it looks like we're at the peak of infection about now.
Right.
There we go. We're kind of saying this kind of online there. So it's
you are saying the same thing. That's a good thing. I just wanted to clarify that, just in case there was any confusion in the community. And I think you've done a good job of that. So thank you. Kathleen, what are you most concerned about in terms of I suppose your GP, with your GP hat on, and from the perspective of someone who's seeing a broad range of patients day to day? What are you most concerned about, say, in the next 6 to 12 weeks?
Well, I think in Newcastle, we're really trying to keep the lid on things. I think we've got a slightly different perspective in that we're still trying to keep the walls up a bit. And I think a bit luckier in that we've had a bit more of an opportunity to try and get vaccinated before there's been really sustained local community transmission. And so I think that, I think our emphasis is still really on trying to keep everyone vaccinated. And I think we'll be having, trying to avoid infection getting into our practices and into our patient communities as well.
Just to sort of take us to the end of tonight's discussion, which has been really, really excellent, by the way. Thank you again for everyone for volunteering your time. It's been really, 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 really useful. And I can see that from the comments that are coming through in the chat box as well. You're answering people's questions, and I think there's a lot more clarity than where we started at an hour or so ago. So that's a great thing. Andrew, I just want to sort of get a sense from you. you know, people are saying there's a lot of lip service from the government. There's a lot of initiatives that are going to start rolling out, for example, with this pathway out of COVID. What's your take on what was announced yesterday, this sort of pathway out, you know, the prospect of vaccination passports? Start with that. What are the sort of pros and cons to that as a, you know, a nugget, if you like, to entice people, A, to get vaccinated so we get out of lockdown quicker, but, you know, is it just the government putting us at ease, or is it actually going to work? Are these ideas tangible?
Yeah, look, I think we can learn a lot from what we've seen around the world already. You know, we are a good 6 months behind what's happened in many places. And the data do suggest that once you reach 70 to 80% double dose vaccinated, then your epidemic does start to come under control. We will still need public health measures, but much less of the lockdown, more of the masks and you know, some distancing, but less of the lockdowns. The whole idea about vaccine passports is, of course, COVID means a very different thing to you once you're vaccinated. Your risk of severe disease is reduced by 95%. So, you know, it frees up the risk of overwhelming the healthcare system. And I think we have to offer rewards to people. You know, completely unprecedented situations demand an unprecedented response. You know, this is a once in a 100-year thing that's happening to us now, and we all want to get to the other side of it. The way to do that is through being vaccinated. We have a highly effective vaccine, which has a low rate of toxicity. We have to get to the other side of this so we're not all locked away and doing all of these infernal Zoom meetings all the time. Yeah, I actually support the idea of vaccine passports to get into pubs and clubs, because, you know, and from the point of view of the business owner, it's about, you know, workplace safety. Your workers want to be protected. They don't, you know, musicians and people who work in clubs and restaurants and front of house staff in shops, they want to be protected. And I think vaccine passports are part of that.
I don't want to get too bogged down in the politics, particularly because there's a lot of people messaging and have been for the last 30 minutes saying, awesome discussion when the politics is removed and we listen to the scientists. I couldn't agree more. But Holly, I want to go to you on that. Is the government's pathway out of lockdown realistic? Do you think it's going to work? Are they good ideas? What are they missing?
Yeah, so there's a couple of things here. You know, certainly we're going to reach a point again with vaccine uptake where, you know, we've already received, you know, what is it now, 75% with first dose, you know, which is above and beyond kind of what the figures we're looking at, you know, back in June in terms of acceptance, which is fabulous. But, you know, we're going to go into this space of having, you know, a proportion of people, maybe up to 10 to 15% in some communities, who continue to be unvaccinated. And that is going to be, you know, really conversations, you know, that will have to be had around, you know, and there was a point in the chat about this, about, you know, whether or not you feel comfortable with catching up with those people, you know, whether, you know, how we're going to navigate this space with unvaccinated people going and trying to enter, you know, pubs and restaurants and so forth. And so, you know, I'm hoping there's going to be some more guidance provided to help navigate that. But, you know, even amongst the friends, you know, situation, you know, I think we are up for some hard conversations about, you know, whether or not, you know, if you do have a friend who's unvaccinated, you know, is it just about giving a little bit more time? And maybe they come around to deciding to get vaccinated when, you know, with other, you know, carrots and sticks applied, they may be that, you know, in 6 months' time, we see a reduction of COVID transmission, we see a new variant, which is not so grim, and we may feel comfortable with catching back up with those people. You know, a lot of parents are having concerns if they have unvaccinated children about, you know, what to do. So I think there are still some challenging conversations ahead.
Kathleen, I want to come to you.
Yeah.
What are the next sort of 6 weeks look like in your mind?
Lots of phone calls and lots of vaccines. Yeah.
Has there been a steady uptake where you are? You said before that you've had generally, like across the board, it's sort of in the last couple of weeks, but even before that, has it been a sort of steady uptake of vaccination?
Yes, well, look, we got a lot busier once the cases started breaking out in Sydney, I will say that. And yeah, we vaccinate, you know, a couple of hundred people every week at our practice, and that's been, you know, fairly consistent for some time now, and it's been really positive seeing as well all the younger people that are stepping up and trying to get vaccinated for their community as well more recently.
And what's your perspective on the government's pathway out?
Well,
give your honest answer. There was a hesitant pause.
Well, I think that it's a very optimistic pathway, and I hope that everyone tries to retain a sense of caution as things start to become more accessible, and, you know, remain sensible and try and keep themselves and their families and loved ones and communities protected through, you know, the other public health things we were talking about earlier. You know, we're still going to need to mask, keep an eye on the ventilation in the spaces we move in as well. With summer, we can crack a window and try and let some of the miasma out. And as well, yeah, try not to get too carried away with freedom, such as it is.
I actually just want to read a couple of the comments to you, because they're really lovely, and particularly because we've reached people in really regional parts of the country, of the state, I should say. Thanks, everyone. It's been a really interesting conversation. We here in the bush in Commerce are still very forgotten about, but they've loved the fact that they've felt like they've been heard and we've answered their questions, which was great. You've all absolutely smashed this. Really incredible discussion. You've smashed it. That's definitely someone who's in their early 20s. Awesome discussion. Thank you all for your time. Much appreciated. Yeah, there's some really, really great feedback. So it was obviously very much needed. And I think you've done a great job of answering particularly some of the or debunking some of the myths around vaccine safety. That seems to be the one thing that's stopping people from taking the step to go and get it. So hopefully out of tonight, that's changed. It's changed some minds in a positive way. Just to wrap up, let's do a bit of a whip around. Andrew, what are the thoughts that you'd like to leave, particularly our community with? Are there considerations that, you know, I mean, people are people, but at the end of the day, our community is our community for a reason, you know, and we stick together, we make sure the information is distributed as it needs to be, and that specific needs are met, because there are specific needs within our community. So what are your sort of parting words to the broader LGBTQ+ community?
So look, I'd say for the moment, stay strong and hold on. It's about another 6 weeks until we're getting a really significant release. And then from there, I think it's a carefully staged release. You know, you'll be able to go to a pub and stand outside. You won't be in crowded clubs for a while. But there will be really significant release in about 6 weeks. So please make sure you're vaccinated. Try your best with what you've heard tonight to tell all your friends to be vaccinated. At the end of the day, we will all be vaccinated, or eventually we'll get infected. And, you know, so yeah, hang on. There truly is light at the end of the tunnel.
That's a lovely positive thought to end on. Kathleen?
These vaccines are safe if you're on HRT and safe if you're immunocompromised. And really encourage anyone who considers themselves in those categories to seek out vaccination with any option available.
Yeah, and look, there's been a lot of questions come through from the trans community broadly. So yeah, thank you so much for your sort of expertise in that area tonight, Kathleen, as well. Holly, with the great earrings.
Look, I think, you know, it is about peer-to-peer conversations. So if you still have those friends or family members who just still aren't sure, then, you know, share your stories. Not just the story about, you know, why did you decide to get vaccinated, but also about your experience. You know, where did you go? How did you book? You know, what was it like to turn up at the clinic? And then especially what's it been like after receiving the vaccine? So we can really break down these kind of myths and misinformation that, you know, there is huge amounts of adverse events. You know, let's get some facts out there about how how we're feeling post-vaccination, and support each other with confidence in the safety of these vaccines.
Yeah, and on that, again, someone's just said, very educational. Cannot thank you all enough for making the information so clear and easy to understand. I think a lot of the conversation tonight has really centered around that. It's so difficult for people to make sense of such a barrage of information day to day, and to get the clarity that you need to make good decisions. So yeah, this has really, really benefited that. I should probably say really quickly too, for anyone that has any more questions or that needs just, I suppose, resource and information that's specific to the community, you can always jump on ACON's website, aconhealth.org.au. They've also got vaccination clinics, I believe. Is that right? That you are running vaccination clinics? Have I got that right? Yes, a big yes in the chat box. Okay, so yeah, jump on aconhealth.org.au if you want to go to sort of, I suppose, a community-specific vaccination clinic. They're available. I'm not sure what areas, but if you jump online and look, you'll be able to find out. Thank you so much, Holly, Kathleen, Andrew, for your time. Thanks to the guys at ACON and the peer education team, Harrison, Tim, Locke, for organising it. I found it really beneficial myself. And as I said, I'm a journalist, and it's been so difficult to digest the bloody information every day. So this was really, really, really great. Great initiative. Thank you for inviting me to moderate it. And thank you all for being here. We're signing off.
Pat.
Thank you, Patrick.
Hopefully we can all meet in real life sometime soon.
Yeah.
See you later.
Good night, everyone.
Bye.
Bye.